Scopinal tablet is used to treat cramps, spasms of the stomach, intestines, and bladder. It may be used to stop spasms prior to radiology imaging. Abdominal pain, discomfort, cramps. Painful cramps should be eased within 15 minutes. How to use. This medicine is intended for adults and children 6 years and older. Take as indicated by a doctor. Take with or without food. Swallow tablets whole, do not break or chew. The unusual dosing is 20 mg 3 to 4 times a day. In children between 6 to 12 years, the usual dose is 10 mg 3 times a day. Doses may be changed in special conditions, so always follow your doctor's or pharmacist's instructions. If you take more than you should, talk to your doctor or go to the hospital straight away. If you forget to take a dose, take it as soon as you remember it, unless it is nearer time for your next dose. Don't take a double dose, 2 doses at the same time to make up for the forgotten dose. Contraindications. Don't take Scopinal if you are allergic to the active substance or any other component of this medicine. If you have glaucoma, if you have myasthenia gravis, muscle disease, if you have or suspect that you have a blocked bowel, if you have a condition where your bowel is blocked or does not work properly, paralytic or obstructive ileus, if you have an enlarged bowel, megacolon, if you have an enlarged prostate gland for men, if you are pregnant, likely to get pregnant, or are breastfeeding. Warnings. Talk to a doctor about all your medical conditions before taking this medicine, including if you have heart problems such as a very fast heart rate, tachycardia, if you have an overactive thyroid gland, if you have difficulty passing urine, if you have constipation, if you have a fever, if you have a liver or kidney problems. Side effects. Serious side effects, eye problems, pain and vision loss. Uncommon side effects may affect up to 1 in 100 people. Dry mouth, dizziness, increased heart rate. Other side effects include difficulty passing urine, constipation, sweating and blurred vision.